The needles that are used for getting the samples are changed for every individual. And what happens if by any chance a person is getting used a infected needle? So what happens then next? Because is it a complete disaster, or any processes there that can be done and the things would be aligned?
So the chances of this happening is like null to zero, I would say, for a patient, because obviously everyone follows a sterilized protocol, but this usually the needle prick injuries usually occur to healthcare workers, because when they tend to take care of multiple individuals, or by some way there are chances that the healthcare workers are prone to these needle stick injuries. So when such an injury has occurred, it is very important to go and notify the particular hospital and particular governance system which they have in that hospital. And so there are certain tests which are conducted on this patient and on the healthcare worker.
Okay, both sides. Okay.
So both their tests, are taken. So certain retropositive tests and certain other tests, infectious screening and infectious tests are taken in both these individuals, and a sample from the healthcare worker is taken and tested for the particular test. And then there is something called the post-exposure prophylaxis. So after the needle injury, a prophylactic regimen or a prophylactic medication is given to the healthcare worker as well.
Okay.
So that if there are anything to keep everything in check, a prophylaxis is given until her results come. So until his or her results come, that particular healthcare worker will be under prophylaxis. And once their results come and everything is okay, then they will slowly be taken off the medication, and even the patient's blood tests will be taken, and so their results also will be checked.
Is there any time limit, like within this time period, if it is done then it's fine, otherwise the things cannot be done after that, or it can be done anytime?
So it is very preferable that the patient and the healthcare worker give their sample immediately within 4 to 6 hours.
Okay.
So within 4 to 6 hours, both their samples to be taken, so that we can actually get to know. And periodically the healthcare worker samples will be taken to look for antibody levels and to look for any other infectious screening to be done. So that will be done, but preferably as early as possible.